everybody, and welcome to Medicine and Science on the Pod TV network. I'm Nick Palavito. I'll be your moderator for today's show, but I'm not a subject matter expert on this area, which is whooping cough. And the thing is, I thought it was gone. I thought they had vaccinations and they stopped it. Now I'm reading 10 kids died recently from whooping cough, 1,500% increase in whooping cough. That's in the United States alone. It's also in Japan and some other countries around the world. So all of a sudden we have this flare up of a disease that I thought was gone, and I thought we had vaccinations for it, but I'm not an expert in medicine. So we have a board certified person who's board certified in internal medicine, who's a real medical doctor, who's going to explain to us basically the ins and outs of whooping cough, Dr. Michael Patmos. Dr. Michael Patmos, this is a very important topic. People are dying, increase of 1,500% in whooping cough, and there's no vaccination. Is that what's going on? We've never developed a vaccination for this.
It's a very complicated issue. And first of all, thank you and good morning. I appreciate the opportunity to speak with you and the audience. And whooping cough, or pertussis, is a disease that I'm passionate about, very interested in, and have personally seen and managed. So, like most things in medicine, unless you have personally managed a patient at the bedside with a disease, you don't know anything about the disease. So let's start with that. You can't read about this in a book or watch a YouTube video and think you understand pertussis. You don't. So here's the important things, what I think is important to know about pertussis. Yes, absolutely. We're seeing a terrible resurgence of pertussis. And once again, people are dying, mostly infants, dying of pertussis. If you've ever seen anyone with pertussis, you will never forget it. It is the cough from hell. It's a cough so bad that you can't stop coughing. Medication can't control you. Cough syrup doesn't do squat against this cough. It has lots of complications. You can cough so hard that you break ribs and blow blood vessels out in your brain and have an intracranial hemorrhage, stroke, and die. That's the kind of cough we're talking about with pertussis. So where did this disease come from? Well, the earliest description of pertussis was in the 7th century in China, where they described an illness where people coughed so badly for 100 days that they died. The next reference to what was likely what was pertussis was in 1697 by a name that every student of medicine should immediately recognize. Sydenham described pertussis, which I believe is Latin or Greek for really bad cough. Here's an important point that I have made before with COVID and with smallpox and polio, for example. Pertussis is a bacterial infection that is only found in human beings. It is a strict human pathogen. There is no animal reservoir. There's no reservoir in nature where this bacteria is housed except in us. We allow pertussis to exist. And there are 9 different species. The one that, excuse me, and most frequently associated with disease is Bordetella pertussis, but there are 8 other Bordetella species. This is a highly contagious bacteria that is in the air from coughing in little droplets, and you see when people cough, they spew out droplets. Those droplets hang around in the air, hang around in the environment. The bacteria is viable for a few hours, and it is passed from person to person. It is highly contagious. Back before we had a vaccine for this, there was about 250,000 cases in the United States every year, and about 1% of people, mostly infants with pertussis, will die, and they die a horrible, horrible death. It's not a pleasant death. There has been a steady increase over the last several decades in pertussis due to the fact that we're seeing decline in vaccination, the fear of autism, Robert Kennedy, and misinformation scaring people away from getting vaccinated. And the only exception to that general increase in incidence was during COVID, where everybody's wearing masks and pertussis went down. As soon as the masks somewhat come off, pertussis comes right back. Pertussis is grossly underreported because in adolescents and adults, it doesn't look as severe as it does in infants. So it's not at all unusual for a teenager or an adult to have a respiratory infection with a bad cough. They're spewing it all over the place, and the doctor doesn't recognize that it's pertussis. They're not tested for it. They're not treated for it. Illness goes on for 3 or 4 weeks. Meanwhile, they've infected a lot of people. Who is the reservoir? Who's responsible for hosting pertussis? Teenagers. Under-immunized teenagers host this. They are the host. They're the cesspool that allows this bacteria to exist. And they have this this bacteria. It's a gram-negative coccobacillus. It's a bacteria, not a virus. They house the bacteria and they spew it out when they cough. And who do they infect? They infect their little newborn sibling. It just came home from the hospital, their little baby who's too young to be vaccinated. And they infect and kill their little new sibling. If you want to eradicate pertussis, you have to go after the reservoir, which is adolescents and young adults who are under-vaccinated, walking around with the bacteria unrecognized and undiagnosed by their physicians who don't know how to recognize pertussis. It can be tricky in the adolescent and the adult. They don't look as bad as they do in the infant. So the treatment for pertussis is simple. It's macrolides, azithromycin, clarithromycin, works great. Easy to treat, well tolerated. 5 days of treatment, boom, you're cured. You can prevent pertussis with vaccination. We should be preventing it with vaccination, but because we have allowed unqualified people to have a podium and a microphone, vaccination rates are declining, and that's why pertussis is coming back. The vaccine isn't great for this bacteria. It's helpful, it works, but it's not the best vaccine we have, but it's the only one we have, and it does work. How does pertussis kill you? This is what, I hate to say I love, but being an internal medicine doctor with advanced training in infection control, how people die of infections has always been interesting to me. With pertussis, you cough so hard that you stop breathing. There's actually apnea associated with pertussis. It also causes feeding difficulties because you can't eat. You cough so hard you can't eat. So children actually starve to death with pertussis. They have post-tussive vomiting. They also you can also break your ribs. You cough so hard, you fracture your ribs. You can also get intracranial hemorrhages and strokes as a consequence. 24% of infants with pertussis will get these kinds of complications. You can also get pulmonary hypertension and encephalopathy. The case fatality rate is about 1%, and it is mostly among infants. Why is this disease coming back? It's only found in humans. What that means is, like smallpox, if we vaccinated everybody on the planet, every single person on the planet, essentially like we did with smallpox, vaccinated everyone. World Health Organization went out into the jungles and into the backwoods and vaccinated everybody. The disease no longer exists. If we did that with pertussis, and if we identified and treated the people who in the reservoir who are infected, we could eliminate pertussis from the face of the earth. It could be the second disease that no longer exists and belongs in the trash bin, dustbin of history. Why is it coming back? It's coming back because ignorance, decline, anti-vax, misinformation, and I think very much because we have made an enormous mistake in this country and around the world. And I think I'm the only one saying this. We have allowed grossly unqualified people access to the public. We have allowed grossly unqualified people to be on Fox News, in social media, on TV, speaking as experts who are not qualified as experts. No one has challenged their credentials. The Fox News doesn't vet the resumes of the people they put on TV, obviously, because they have unqualified people commenting as experts. Just yesterday, the CDC held their ACIP meeting. That's the Advisory Committee on Immunization Practices. That's the committee of experts who advises us what to do with what vaccine for the next year. On that committee now is a member appointed by Robert effing Kennedy named Dr. Tracy Beth Hogue. Who is she? Well, she testified in front of Congress. She's a family doctor with a sports medicine fellowship. Her area of expertise is sprained ankles and torn rotator cuffs. Her area of expertise is not infectious diseases. She's not a fellowship-trained infectious disease expert. Why is she testifying before Congress about vaccines? Why is she on the ACIP? She's grossly unqualified. Those aren't my words. Those are the words of Dr. Angela Rasmussen, a PhD professor of virology who is on the ACIP. She yesterday, after hearing Dr. Hogue's comments, said, this woman is grossly unqualified. Grossly unqualified. Why do we have grossly unqualified people sitting on CDC ACIP committee? Can someone explain that to me? But Tracy Beth Hogue isn't the only one who's grossly unqualified. All of Trump's health appointees are grossly unqualified to opine as experts in infectious diseases. Every single one of them. None are fellowship-trained infectious disease doctors. Obviously not Robert Kennedy, he's not a doctor at all. Not Jay Bhattacharya, he's an economist, has no training in infectious diseases. Peter McCullough, Robert Malone, Pierre Corey, Mehmet Oz, Marty Makary, Tracy Beth Hogue, Mary Smith Bowden, whatever her name is, ENT in Texas. None of these people are infectious disease doctors. Why are they being allowed to opine as experts? They're entitled to their opinion under the First Amendment. They can stand on a street corner with a microphone and a PA system and say whatever they want, but they cannot testify or opine as experts. Only an expert is an expert. None of these people are experts, and somehow we have allowed them access to the podium, access to the microphone. They're now in power, in charge, dictating policy, and they are, as Dr. Rasmussen said, grossly unqualified. We need to demand qualifications, credentials, education, training, and expertise that is proven and verified. You cannot trust a resume. Just because someone puts a resume out there, you have to verify everything on that resume. I have done that with many of these people, and their resumes are loaded with false information and embellishments. That's fraud. It's professional misconduct, and it needs to be. People need to be held accountable for that. That's what we need to do to turn this around. We've got to vaccinate everybody. We've got to treat the reservoir, and we've got to silence these false experts. They're fine. They can have their opinion as a person, but they cannot opine as an expert. Only an infectious disease doctor, a clinical infectious disease doctor, can opine as an expert on clinical infectious diseases. Cardiologists can't, pathologists can't, an economist can't, a lawyer can't. Unless you're a board-certified, fellowship-trained infectious disease doctor, you are not an expert in clinical infectious diseases. With that, I'll stop shouting and turn it over to you.
Well, it seems like we have a problem in the United States of America. I'm grateful for Spain because they don't have these same problems over here, at least right now. But we do have some other experts. We have Rick Rosner, who's joined us. And I don't know, Mark,
I'm not an expert on anything, but question for you.
Yeah.
When a little kid is, I found one more way that whooping cough can mess you up. It can make you go blind. You can cough so hard you can bleed into your eyes.
Yeah.
And if you're nearsighted, it takes kids a while to become nearsighted, but you could cough so hard you could detach a retina.
Yes.
Oh, great.
If you're nearsighted as an adult and you've got a cough and you see a white ring in your visual field when you cough, you need to get that treated. That's a sign that you're coughing so hard your optic nerve wants to pull away.
Right.
There's a long list of things. I only mentioned a few of them, but thank you for pointing that out.
It sounds like.
And I have a question for you. So when a little kid is coughing the life out of himself, why can't you hit him with Botox and shut down the coughing reflex?
I suppose, I don't know. That's a good question. I don't know. I think the cough is so severe. I've seen patients with pertussis. The cough is hideous. So I guess they anesthetize. I don't know. You'd have to talk to a pediatric intensive care physician.
Okay, one more thing. This Peter McCullough guy, who's a fraudster, a charlatan, he popped up on my Twitter yesterday saying that the COVID vax decreases pancreatic survival rates by 50%. And I'm like, that's a scary thing to see until you see McCullough and you know it's some kind of bullshit. So that was yesterday. Today, legitimate scientists, legitimate doctors who understand math explain why his numbers are bullshit.
So McCullough is a cardiologist. He lost his board certification. His lane, doctors, if you go to the hospital medical staff bylaws credentials committee, there's a lane you stay in. That's your credentialing and your privileges. McCullough's lane is cardiology. It doesn't include infectious diseases.
Yeah.
I do have a quick question for you, Dr. Patmos and everything. It's actually getting away from whooping cough, but it does come into the area of ethnicity and all along those lines. So I was just wondering, because you kind of alluded to it earlier, and I do have as part of my own ethnicity friends and relatives that claim more of it than the other part of our ethnicity, which is the Native American population. So I do know that there is an increase in a lot of the diseases that you study that are in the Native American population, whether that's influenza, whether that's tuberculosis, or whether that's a number of other things. So why are the people that are considered First Nations people being impacted greater by infectious diseases, and what can people in that community do to alleviate these disparities?
That's a great question. I haven't researched recently the genetic, if there's any genetic predispositions, but I can tell you, just generally speaking, I used to run, for a short period of time, I was an interim CEO and chief medical officer for a tribal health system. And so I have some exposure to Native American health. And one of the reasons why Native Americans and other ethnicities may have greater burden of disease when it comes to infectious diseases is because of healthcare disparities and access. This is why diversity, equity, and inclusion is so important, because under that heading of DEI comes healthcare disparities. Right. Some people in this country have fantastic access to excellent doctors. They don't suffer from these things. And other people don't have great access to excellent physicians and great access to great medical care, and they suffer more. This is called healthcare disparities, and it's based upon demographics, and it's based upon economics and geography and where you live, ethnicity. Certain ethnic groups are harmed because of these healthcare disparities. I suspect that has a lot to do with why folks in the Black American community and the ethnic Indian and Native Americans may have worse result or a worse problem with this. I can tell you, if you live in the middle of Idaho, in central Idaho, you have to go 100 miles to get to a healthcare provider over mountains that are closed, where the pass is closed for 3, 4, 5 months in the winter because you can't get through. That's not called good access to healthcare.
Well, what about seniors? Are seniors subject to whooping cough? I mean,
yes.
Is this seniors?
Yes, seniors are subject to whooping cough, and if they get it, they suffer badly. Yes.
And if you're on blood thinners and you're coughing your guts out, you're more likely to get a bleed.
Yep. Yeah, exactly.
Very good. you know.
So whooping cough is still around because I thought that was done. Know that it was definitely. I guess it was the major times that whooping cough was around. Would that have been around the time of, if I can use the movie analogy, the westerns and things along those lines? Was that when it was spiked, or was it spiked at another time in history?
No, I think whooping cough was epidemic, and it was everywhere until vaccination came along. I mean, it was a disease that, doctors before vaccination, doctors saw whooping cough all the time, dating back to 1697 when Sydenham first described it. Whooping cough, 1697. It was an everyday disease. Doctors from the old days recognized it immediately, knew exactly what it was. Of course, they had no treatment, but they knew exactly what it was. But today's doctors, most of them have not seen a case and don't recognize it. And that's a problem with adolescents who have whooping cough.
In the year 1900, the average lifespan in the United States was about 40. And it wasn't because people dropped dead at 40. It was because diseases like this were rampant in children and killed 10% of kids did not make their first birthday. If you could make it out of childhood, you could live into your 60s. But diseases that we now have vaccines against, we're just killing kids right and left. And
Dr. Patmos, is there a vaccine available today for whooping cough?
Yes, absolutely. There is a vaccine available, and it's quite effective. It's not perfect, but no vaccine is perfect. Let's not let perfection be the enemy of the good. Yeah, there is a vaccine against whooping cough, and if you've not been vaccinated, you should. If your vaccine was a long time ago, doesn't hurt to get boosted and get another one. These vaccines are safe and effective. And I was reboosted. I was revaccinated just a couple years ago.
And even a non-perfect, like measles, is really good against measles.
Yes.
But even a less good vaccine protects you if you're in a cluster of people who have all been vaccinated. It has to make it, across a chain of infection to you. And if the odds are lower at each link of the chain, it'll likely not make it to you.
A good point. A lot of people will say things like, the flu vaccine, it only protects you 30, 40% of the time. That's a failed vaccine. Well, let me ask you a question. If you had something that would give you a 30 to 40% better likelihood of hitting the Powerball lottery, would you take advantage of that? You certainly would. You'd be in line at 7-Eleven. If you had something that could give you a 30 to 40% better chance of not getting cancer, would you do that? Oh, you betcha. You'd be right down there getting it. Having a vaccine that gives you a 30 to 40% chance of not getting influenza is a good vaccine. That's, so anyhow.
Yeah, that's very good. Hey, Dr. Patmos, really quickly, and I know that it's one of the things that came up during the COVID pandemic. It's come up, I guess, during these other vaccines as well, and all along those lines. But we're in the time of fame because humans, as by nature, are social beings. We are oftentimes very social, and all along those lines, we love being around other people and everything like that. I mentioned the Native American culture, and one of my cousins was actually several of them will be in town attending one of the major powwows, and we're getting ready to hit fair season and time for people to go to the beach and everything. That means they'll be around people and everything like that. So how much is it this social aspect of people playing into our need to get these vaccines? Because we as humans are naturally social. I mean, there's some people that are antisocial, but they are, in my mind, the minority, not the majority.
Mark, there's a reason why we call infectious diseases infectious. There's a reason why we say they're contagious infectious diseases. Yes, all infectious diseases are spread person to person. Right. The closer you are to people, the more people in a room, the more people at a gathering, the more likely you are to share infections. Now, you could say, well, theoretically, if you were a hermit, if you live in a hermetically sealed bubble on, some island in the middle of nowhere, you would never get an infectious disease from another person.
I remember that movie. I didn't like that movie. The movie where the guy was in a bubble and everything like that. I didn't like that movie.
But I talk to patients every day who don't seem to comprehend the fact that the illness they have, the infection they have, they caught from somebody else. We're missing basic biology here. These diseases are spread person to person. We have to take steps to reduce person to person infection.
So, but contagious diseases generally go down during the summer because the outside is way bigger than the inside.
Yeah, the outside is way bigger than the inside, but you do have.
But I have a question about the COVID vax. So people are arguing there's the Moderna vaccine, and then there's what is it, Nova? There's one that's supposed to work a little different. That's supposed to be the gold standard. What's the difference?
I know gold standard. That term belongs in economics. It doesn't have anything to do with it. You know, we have multiple different vaccines available for COVID. The first vaccines that came out were the old viral vector-based vaccines. It's an old junk model. We do have some vaccines that are still viral vector-based, but it's a very impure, not a precise thing, and it had a lot of problems. It was taken off the market in the United States, and there were some associations with some clots and so forth. So that those viral vector-based vaccines are not used anymore. Then we have the messenger RNA vaccines, which are clean, safe, and effective. Clearly, the best model going forward for vaccines is based on messenger RNA, which was not discovered by Robert Malone. And we also have this new vaccine, Novavax, which is another type, not a messenger RNA type vaccine. That vaccine is ready to go. Data is good. It looks good. It's a good alternative to someone who's afraid of messenger RNA.
People are saying that's the one to get. Does it really make a difference?
They're saying that because they're afraid of they bought into the anti-messenger RNA baloney. The problem is that the Novavax vaccine, the approval was stopped by Kennedy and the FDA. It didn't get approved. It's been tabled. So they're denying access, the public access to the Novavax.
Even though it doesn't use the same
These people are so ignorant when it comes to molecular biology. They don't know the difference between a messenger RNA-based vaccine and an adenovirus-based vaccine. They don't know the difference between RNA, DNA, transfer RNA, messenger RNA. They don't understand nucleic acid transcription, translation, and protein synthesis. Because they don't have the basic knowledge, the basic understanding, they can't opine as experts. They're missing the whole foundation of all of the science in molecular biology. They don't have it.
Yes, I share that with RFK Jr., where in college, I'd start a genetics course and then I'd be like, oh, I'm going to have to concentrate. And then I'd drop the class. So I'd have like this little dribble of knowledge. RFK said he was the same way until he became addicted to heroin. Then he said he was able to calm down.
He could concentrate in class when he was high. Yep. So
big problem. Well, the thing is, I think for our audience, they have to know there is solutions out there, and that's to get a vaccine or have your kids vaccinated from the whooping cough, because vaccines are available. If they weren't available, then of course this could be a more serious problem. But right now, it's not just a problem in the United States. We're seeing this problem all around the world. And so I think that for our audience, not just in the US, but around the world, you're going to have to take a look at this, because it seems to me your choice is get a vaccination or basically risk dying a very horrible death, which is something.
I got one last point. If you're a doctor, go on Up to Date now. You should be going on Up to Date every day anyway. Go on Up to Date now. There's about 6 topic summaries on pertussis. Read them, review, refresh your memory. There are people walking into your office every day with whooping cough and you're missing it.
Yeah.
There's one more way to stop teenagers from spreading it, and that's just to stop making teenagers. We have a worldwide baby crisis where we're making, 10, 20% fewer babies because we're so distracted by social media and who knows what else. So in 15 years from now, we will have 20% fewer teenagers to cough.
Wait a minute. Hold on a second.
One
Hold
is
on a
too much.
second.
Right, we have to go with the half
I know we're
hour mark.
ending the show, but we can't be giving
Something
the
to do with no
teenagers. I got
teenagers.
2 teenage nephews.
No,
well.
I'm being sarcastic, but I'm just saying there will be fewer teenagers 15 years from now.
Yeah,
What's Trump
but
gonna
watch the whooping cough. We'll be covering it for you on Medicine Science at Pod TV Network, and not just in the United States, but worldwide. We'll see you next week. Bye bye.